New policies are being implemented at the White House in response to the coronavirus pandemic.
I had my temperature taken coming into the room.
So did we.
You did? Good.
Everybody coming near the president or vice president is getting their temperature checked. The president says he was tested for coronavirus after coming in contact with at least 3 people who have tested positive.
People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
The House passed a bill early Saturday morning, which will make testing free for Americans. It now goes before the Senate for approval.
Leader McConnell and our friends on the Republican side should pass the bill as is.
The Trump administration says it will boost the number of test kits available to the public to 1.4 million over the next week. Drive-through testing locations have been set up in numerous locations across the country, including here in New Rochelle, which has been the epicenter of the outbreak here in New York.
The main way to slow the spread, we know from all the other countries, is to do the testing, isolate the positives.
Health officials are warning the worst is yet to come.
We have not reached our peak.
The Trump administration has also announced it's extending its European travel ban to include the UK and Ireland. And Vice President Pence wouldn't rule out the possibility of a travel ban within the U.S.
We're considering a broad range of measures, but no decisions have been made yet.
Meanwhile, schools and businesses continue to shut their doors as Americans practice social distancing. Apple announced all of its stores outside of China will be closed for 2 weeks. Michael George, CBS News, New Rochelle, New York.
A senior official at the Department of Homeland Security tells CBS News a domestic travel ban is not in the works at this time. The majority of COVID-19 cases are mild to moderate, according to health experts. But the problem with the virus right now is not necessarily about the severity of a patient's symptoms. Now, we can't say this enough. The CDC says the clear signs of a coronavirus infection are coughing, fever, and shortness of breath. You need to contact your doctor if you experience these specific symptoms. Last week, we caught up with infectious disease expert Dr. Michael Stevens with VCU Health. He says everyone, no matter their age, needs to take this seriously because anyone who contracts COVID-19 can transmit it to others who are more vulnerable.
If a healthy young person gets influenza, usually they will have the infection and then it'll go away and they'll recover from it. They'll feel terrible for a while, but then they'll recover from it. But if they get it and spread it to, say, somebody in their 80s who may have chronic heart and lung problems, that person who they spread it to is at much higher risk for things like death.
Dr. Stevens says both COVID-19 and the flu are major health concerns. The difference is the amount of unknowns surrounding COVID-19. This morning, Governor Ralph Northam traveled down to Virginia Beach to tour the Centura Health COVID-19 Incident Command Center. Centura healthcare officials tell us the command center will be used to help them adapt to this rapidly changing situation and the demands of this outbreak. Senior clinical leaders will be available to coordinate with local, state, and federal agencies to develop protocols.